Welcome back. Now, many people around the world, frequently in need of dental advice and guide. And Dr. Dibia, of course, Nze, is the Chief Dental Officer of Deseret International Hospital. And he's going to be sharing with us how to properly take care of your dental braces. Many people always say, dental braces are for the rich, but sometimes we have situations where it's possible that a child might need dental braces, and you might need some help in that particular area. So this is a good topic to look at this morning. Dr. Dibia, thank you so much for joining us this morning.
Good morning.
How's it going? I know that you are essential services, so you're able to move around. But how's it been dealing with this COVID-19 situation for you in Lagos?
I've tried not to be essential in my services. I have only been attending to emergencies, so I'm staying indoors most of my time.
That's good. So let's just go straight to it. We don't have that much time. Let's start from braces. What braces are and who needs braces before we talk about how to care for dental braces, so that we can situate the discussion this morning. So talk to us about braces, who needs them, and why they're so important.
Yes, so a lot of people do not know what braces are. They just know they are things that people put on their teeth. Braces are orthodontic dental appliances that are fixed to the tooth to make tooth movements. So for people who have malaligned teeth, malocclusions, teeth that they do not like the arrangements, the only way we can make these tooth movements to arrange them to the way the patient wants and the way we want is by using braces.
So are there any conditions that make, are there any specific conditions that make a parent choose to have braces for their child, especially like in a critical case, even if they're not so well off as people think?
Yes, so the first indication we want to look at is functionality. Are you able to speak right? Are you able to chew right with your teeth the way it is? For some individuals, the positioning of their teeth does not allow them to talk right. They also cannot chew right. So they want to use braces to correct that functionality. Another indication is aesthetics. For some people, they are not able to smile because they feel their teeth is not in the best position. So they also want to use braces. So top on the list is functionality and aesthetics. That's why so many people come to do braces.
All right, so finally, before we talk about care, why are braces prohibitively expensive? Anytime somebody talks about braces, even especially for children or young people that definitely look like they need braces, it just looks like most people are not able to afford them. Is there something that can be done in this area?
Unfortunately, there is not much that can be done in this area. Braces are expensive all over the world because of the materials that are used to make the braces appliances. It's quite expensive. Another thing that makes it expensive is the length of time that you have to wear those braces. So an average braces treatment is about 18 to 24 months. So imagine having to wear an appliance on your teeth for that length of time. You always run the risk of having them fall off, having them break, and then you have to replace them intermittently. So throughout that span of 24 months, a lot of money will be spent on your braces.
Wow. All right, so let's go to caring for braces. So I've approached the hospital, I've met with the dentist, they've recommended me to wear braces or whatever. So what then happens after? So take us through the process first of you fixing the braces, diagnosing whatever condition it is, and then taking care of it.
Okay, so the first step we do is we do a clinical assessment. After we have done that clinical assessment, we take radiographs. Now, these radiographs show us your skeletal positioning, and we can use that as a baseline because we want to have the position at start and then the position at the finish of the braces treatment. Now, one thing we need to always remember is the only time your braces can function is when they are on your teeth. So for caring for the braces, we tell you make sure that the braces appliance stays on your teeth. Anything that is going to knock your braces off, definitely your braces will not be working at that point. So for care of the braces, we are looking at things like what you eat, how you talk, the things you put in your mouth. All of those things come together to help care for your braces. Now, because your braces is like an external object put on the teeth, cleaning is sometimes difficult. And a mouth that is not cleaned appropriately would have lots of germs, lots of inflammation, and then there are other problems that can now arise from that process. So what we do is we want to emphasize strict cleaning. We tell every individual brush twice every day, but the person who uses braces, we tell you to brush after every meal.
Wow.
Don't even give yourself time. So usually you have a pouch, a small pouch that you carry around that contains your basic oral hygiene toolkits.
So it's different for somebody who's wearing braces. It's a different kind of regimen that you would have.
Yes.
If you have braces on.
Yes, the regimen is really, really strict. You should brush after every meal. There are certain kinds of food that you cannot eat.
Like what?
Things like apple. You cannot go digging your front teeth into apple, carrots, all of those things. You cannot eat them.
Wow.
The only way you can enjoy those kinds of meal is you take a knife, cut them, and then eat directly from your back tooth.
So eat directly from the back.
Yes, eat directly from the back. So you cannot just buy an apple on the road and
or worse, sugar cane or coconut.
Yes, you can't eat nuts. All types of nuts are even out of the way. Nuts, coconut chips, plantain chips, anything that is too hard can easily knock off your braces. Also, on the flip side, anything that is too soft and sticky would also adhere to your braces. So there is no chewing gum for you. There is no taking chocolate and chewing of candies for you. So it's a strict process.
It's a
very strict process.
So you basically carry this pouch around that has your little toothbrush in it, so like a travel pouch that lets you move around.
Yes, it's like a travel pouch.
And so if you're maybe at the office, you can then go to the bathroom and quickly brush your teeth after the meal.
Yes, and quickly brush.
Wow. And you have to do this for about 2 years.
You have to do it for about 2 years.
Wow.
You have to do it for about 2 years if you want your braces to last long.
Well, I just wish that more people can have access to this particular service so that we can have people with better teeth around us in our country as well. But thank you so much, Dr. Dibia, for sharing this with us. I'm sure that a lot of people who are watching have gotten some information. And now people have been wondering what these people have on their teeth. What are these things that people have on their teeth? They're called braces, and there's a reason for them. Anyway, thank you, Dr. Dibia. We'll talk again next week sometime.
Thank you very much. You have a good day.
All right, quick break now and be back with more.